Thank you, Mr. Chairman. I left the practice of medicine, I left caring for patients for over 20 years for precisely this moment in public policy. I cared for literally thousands of patients as an orthopedic surgeon, each and every one of them a privilege. The actions being taken here are part of an attempt to fundamentally alter our health care financing and delivery structure. It's an historic occasion and remarkably consequential to all Americans because of the very specific decisions that we will make that may, in fact, adversely affect how they are able to ensure the health of themselves and their families. As a physician, it's been my steadfast desire for us to achieve full access to affordable quality health care while preserving the patient-doctor relationship without governmental interference. And yet the proposal before us today takes us very far from the American people's vision of reform. Let there be no doubt. After nearly a quarter century as a practicing surgeon, no one thing had a greater negative impact on my ability to care for my patients and the manner in which medical services are provided than the intrusion of the state, the federal government. In fact, for new Medicare patients, it's virtually impossible to find a doctor who will be able to see them due to the ridiculous rules and the inappropriate reimbursement. Former patients of mine are unable to find a doctor to care for them because of the intervention of the federal government. Ask your constituents. You know it's true. I know that Medicare didn't allow for the most effective treatment for many of my patients for whom I cared for years. Medicare patients received second-class care due to the decisions from the bureaucracy and successive Congresses just like this one. This has severely eroded the ability of patients and their doctors to make independent health care decisions, some of the most personal decisions that we make. The day an American turns 65 years old, they become second-class citizens regarding medical care. If doctors are honest with you, they will tell you this. And the doctor-patient relationship, once sacrosanct, is being trampled by coverage rules, inflexible regulations, and one-size-fits-all policies. When you pour through this proposal that we have before us and you conduct a critical analysis, one appreciates that we are transferring the worst of our current public health care systems to the health care to be provided for every single American, permanently institutionalizing failures of our current government payment system into the entire American health care delivery system. This means more federal supervision and administration, leading to a system built on mandates, rationing, bureaucracy, and taking health care decision-making away from patients and their physicians. This bill continues to be wedded to a government-run health care plan known as a public option. It will force over 100 million Americans out of their personal health care coverage and into the government-run plan. This is wrong, unwarranted, and destructive to the quality care for my former patients and all our constituents. Or take the newly created Health Benefits Advisory Council, comprised mainly of federal bureaucrats and presidential appointees. It's ostensibly being established to make recommendations on minimum health benefit standards and cost-sharing levels. And what it will really do is destroy independent physicians from being able to determine what specific care individual Americans may receive. When I was practicing medicine, my patients would bristle when they understood that I was handcuffed in making independent decisions. And this is what we will do for every single medical decision if we adopt this proposal. This is a plan to fundamentally alter the relationship between government and its citizens, turning the people into wards of the state. But there is hope, as there are alternative positive solutions which trust patients and doctors, because the status quo is unacceptable. And to my friend from New Jersey, we believe the status quo is unacceptable. Reform must be built, however, upon dual pillars: a tax structure in which care is accessible to all Americans everywhere. Every single person understands that it makes financial sense for them and their family to have health insurance. And secondly, have that health coverage truly owned and controlled by patients. That is what we ought to be doing, not forcing every single American into a system that of necessity will betray those health care principles Americans hold dear: accessibility and affordability and quality and responsiveness and innovation and choices. In the end, a health care reform package should empower Americans with the opportunity and allow free people the right to make free decisions. Achieving this positive type of change will be only possible by embracing in a bipartisan manner a fundamental rethinking of our health care delivery system. a system which champions personal ownership and coverage. The alternatives available to us are not just a healthcare system run by an oppressive government or a monolithic insurance industry. We have an opportunity to truly empower those most affected by all treatment, patients and their families, so that our system respects them and recognizes the remarkable personal decisions made by each and every American family in their personal health care. So in closing, Mr. Chairman, I challenge each member of Congress to recognize and appreciate that the action they take on this proposed bill may be the most important they take in their entire public career. For those of us who spent our professional life fighting for and caring for patients, I implore you to think about what will help improve our system, not simply check a political box that says we fixed it, when in reality the box being checked will say we destroyed it. And I yield back.